How does amantadine treat Parkinson's motor symptoms and dyskinesia? Imagine a medication that can help smooth out the rough edges of Parkinson's disease, easing both slowness and involuntary movements. That's what amantadine does, and it's quite remarkable in its dual role. Originally developed in the 1960s as an antiviral drug, scientists later discovered it also benefits people with Parkinson's. Its effects are backed by clinical studies and are widely used in managing symptoms today. At its core, amantadine works by influencing dopamine, the brain chemical that's deficient in Parkinson's. It boosts dopamine releases from nerve cells and helps prevent its reabsorption. Think of it as giving dopamine more time to do its job, helping to improve movement control. This action can reduce symptoms like stiffness, tremors, and slowness, making everyday tasks easier. But amantadine doesn't stop there. It also acts on a different part of the brain involving glutamate, a chemical that excites nerve cells. It blocks certain receptors called NMDA receptors, which helps balance brain signals that control movement. This balancing act can lessen the severity of involuntary movements known as dyskinesias, which often develop after long-term use of Parkinson's medications like levodopa. Clinicians often use immediate-release amantadine to help with motor symptoms early on or alongside levodopa when its effects start to fade. Over time, some patients develop dyskinesias, and here amantadine shines again. It can significantly reduce these involuntary movements, improving quality of life. In 2017, the FDA approved an extended release from called Glutamate specifically for dyskinesia, allowing for once-daily dosing, which many patients find convenient. Research shows that amantadine works by modulating activity in different brain pathways that control movement. It increases activity in one pathway that promotes movement and decreases activity in another that causes unwanted movements. This dual effect helps restore a better balance, leading to smoother, more controlled movements. Dosing varies depending on the formulation. The most common is a 100 milligram capsule taken multiple times a day. The extended-release versions, like Glutamate, are taken once daily, making medication schedules simpler. While both forms are effective at reducing dyskinesia, the choice depends on individual needs and tolerances, so it's important to discuss options with a healthcare provider. It's also worth noting that although amantadine isn't classified as an anticholinergic, some people experience side effects like dry mouth, urinary retention, or constipation. These should be monitored and discussed with your doctor. The exact way amantadine produces these side effects isn't fully understood, but they are generally manageable. Overall, amantadine's ability to improve motor symptoms and reduce dyskinesia makes it a valuable tool in Parkinson's treatment. Its multiple mechanisms of action, enhancing dopamine activity and regulating glutamate signals, work together to help patients move more comfortably. Remember, every person's experience is different, so always consult a neurologist or movement disorder specialist to determine if amantadine is right for you and to tailor the treatment plan to your needs.